Hi, my name is Alicia, and this is my presentation on traumatic brain injury and autobiographical memory loss. A common misconception is that a traumatic brain injury can cause a loss of autobiographical memory and personal memories. Another myth is that another conk in the head can cure the first amnesia. Amnesia is a cinema plot favorite. These characters often suffer a violent accident and experience retrograde amnesia, in which they can no longer recall their identity or recall memories from the past. Characters often recover their memory by being conked in the head again. The cinema has made millions of dollars off of movies based on this exaggeration, such as The Vow, Jane the Virgin, and Bourne Identity. In Jane the Virgin, Michael suffers from multiple shocks of electroconvulsion therapy and experiences retrograde amnesia, in which he forgets his past life, including the love of his life, and has a change in personality. Eventually, the character regains his memory back and reunites with the love of his life. The following slides will discuss how realistic this is. Traumatic brain injury, or TBI, occurs when a sudden trauma causes damage to the brain or an object pierces the skull and enters brain tissue. So, for example, accidentally hitting your head on a hard object, car crashes, falling down the stairs, an assault, or getting hit during sports. The severity can range from mild to severe. A patient with a mild concussion is defined as experiencing a brief change in mental status or consciousness. A severe concussion is defined as an extended period of unconsciousness or amnesia after the injury. Those who have suffered a mild TBI often report more confusion, difficulties concentrating, problems with memory and reasoning, problems with sensation such as sight and balance, language difficulties including communication, expression, and understanding, and changes in emotion such as social inappropriateness, depression, anxiety, personality changes, and aggression. Autobiographical memory, or AM, refers to our knowledge or recollection of personal experiences. It is comprised of two different components, semantic and episodic. Semantic refers to general updated knowledge about the world. Episodic refers to specific experiences that individuals can recall from their lives. Autobiographical memory is supported by a network of regions including the medial and lateral prefrontal, posterior cingulate, and medial and lateral temporal cortices, and the medial temporal lobes. The hippocampus is located in the medial temporal lobe of the brain. It plays a vital role in regulating learning, memory encoding, memory consolidation, and spatial navigation. People with extensive hippocampal damage may experience anterograde amnesia, or the inability to form or retain new memories. This is because the memories have already been consolidated over time. It involves the transfer of memories out of the hippocampus to other parts of the brain. Therefore, you would likely not lose your own memories because they have already been consolidated and redistributed to other parts of your brain. You are more likely to have difficulties forming new memories. The common injuries that occur by traumatic brain injury are the frontal and temporal lobes, because it is where the head has greater range of movement. The frontal lobe controls personality, planning, initiating, and organizing, while the temporal lobes are involved in memory functioning, certain language functioning, and sensory input. Damage to the frontal lobe is often a result of rapid acceleration-deceleration type events, such as car crashes, while damage to the temporal lobe often occurs as a result of vehicle crashes, falls, and firearms. The origin of these beliefs are not really known and are likely based on the exaggeration of how amnesia can occur. In relation to TBI, amnesia can occur on two occasions: trauma and in the acute phase of TBI, which will be discussed later in the slides. However, we do know that the origin of the double conk to cure amnesia comes from a paper published by French scientist François Xavier Bichat. He decided that the two hemispheres acted in synchrony. One side mirrored the other and vice versa. He also proposed that a second blow could restore the wits of someone who had a previous concussion. Bichat justified this idea by reasoning that the hemispheres that are in balance with each other function better, while those that are out of balance cause perceptual and intellectual confusion. It wasn't until the mid-1800s that scientists began to realize that taking a hit to the head might just destroy memories completely. A second blow wasn't likely to jumpstart the brain, they realized, but create further damage. Evidence from the research is mixed and inconclusive regarding whether mild to moderate TBI may have adverse effects on autobiographical memory. Severe TBI has been associated with deficits in episodic memory, which, as you recall, refers to specific experiences that individuals can recall from their lives. Impairment in episodic memory may contribute to difficulties with learning and retaining new information, as well as recall of functional tasks, appointments, assignments, and obligations. Although TBI affects new memories more than old ones, people with TBI may have trouble retrieving the correct information when needed. So, for example, knowing you have an appointment but being unable to recall the time. So, are any part of the beliefs based on research findings? Well, as mentioned earlier, dissociative amnesia is rare and is usually associated with severe emotional or psychological trauma, such as being the victim of a violent crime. An example would be getting robbed at gunpoint and hit in the head. The traumatic experience can result in the loss of personal memories and autobiographical information, but usually only briefly. It is unlikely that traumatic brain injury would cause retrograde amnesia, but there is evidence that humans who have experienced severe, long-lasting traumatic stress, for example, Holocaust survivors, show atrophy of the hippocampus more than other parts of the brain, which may cause the difficulties in memories. So in Jane the Virgin, Michael losing his memory for 3 years is very unlikely. The second occurrence is when individuals are in the acute phase of TBI, which is less than 3 months since the accident. The individual may present with symptoms of retrograde amnesia and confabulation, which refers to the creation of false memories, but symptoms usually improve after 3 months. Lastly, individuals who experience more severe TBI are at higher risk of memory deficits. Brain volume loss as a result of TBI is linked to autobiographical memory processing. This is due to the loss of neurons caused by injury and swelling. So in conclusion, profound amnesic syndromes usually develop as a result of neurosurgery, brain infection, or a stroke, and rarely happen as a direct result from TBI. The most common form of amnesia after a traumatic brain injury is actually anterograde amnesia, not retrograde amnesia. Anterograde amnesia is the inability to form new memories. A great example is Dory from Finding Nemo. Lastly, amnesia cannot be cured by a double conk. In fact, it'll make it worse. However, there are several treatments to address memory deficits, and most can be done through problem-solving therapy. Some examples of these include setting extra reminders, using Post-its, and reducing the amount of distractions you have while learning new material.